So McDonald's method is used to determine how old a fetus is or expected date of delivery. And we use measurement. Yeah. So the McDonald's method helps us to determine how old a fetus is, okay? And the expected date of delivery. And how you can do that is basically you just measure the length of the uterus from the pelvis to the top of the uterus. And then, as we said, you're going to use a calculation. You're going to multiply that by 8, and then after that, divide it by 7, okay? And we've already gone through some calculations. So I gave you an example that if you measure the height and it's 23 centimeters, if you measure the height and it's 23 centimeters, what is going to be the gestational age of the fetus? So you multiply 23 by 8, and you get 184. And then you divide the 184 by 7. So it will give you 26 weeks. That's it. Okay. Now, we are learning about what are some of the things which can make McDonald's method go out of whack. Number one will be the maternal height. So if you have a mother who is short, that can contribute and give you an error about the age of the fetus. Number two, if the fetus is growing an irregular pattern, irregular fetal growth, then that can also be a problem. Then someone said twin gestation, and not just twins, triplets, quadruplets as well. So that's also possible. And if there's abnormal amount of amniotic fluid, so it's either that the amniotic fluid is so much or the amniotic fluid is little, the McDonald's method would also not work, okay? And if there are large uterine fibroids, because the uterine fibroids can make, the uterus very large when you are trying to measure it. So then that's also a problem. So that is the McDonald's method for you. And then the quickening method is basically the first time the baby kicks, the first time that the baby will kick, okay? That is the uterine method, the first time the baby will kick. So that's the quickening method. So feeling of fetal movement by the mother. Usually it occurs between 16 to 18 weeks, 16 weeks and 18 weeks, okay? And it is less accurate for determining the expected date of birth of the baby. Less accurate. But then, some people will say, okay, so when did the fetus kick? Oh, I remember, because, when people are pregnant, they really note some of these things. Oh, I remember it was on this date. Okay, then maybe the fetus is around 16 weeks to 18 weeks. Then you can use that to calculate when the baby is likely to be born. So these are the three things: the Nagel's method, the McDonald's method, and then the quickening method, okay? So let's talk about measurement of the fetal heart rate itself. So I'm sure a lot of us are familiar with this particular Doppler fetal monitor, where you put it on the tummy, and then you put on a tummy, and then you get the results you want to get by getting the fetal heart rate. So usually, as early as 8 weeks, you can use the ultrasound Doppler. Okay, as early as 8 weeks, you can use the ultrasound Doppler. But then when it goes beyond 8 weeks, so 10 to 12 weeks, then that's when you can use the Doppler fetal monitor to check, right? So you can use the ultrasound Doppler as early as 8 weeks, but then when we go to 10 to 12 weeks, then you can use this Doppler ultrasound or this Doppler to check.